As far as outpatient hip replacement, a lot of people don't necessarily like the idea of staying in the hospital setting. If it's not hurting that much and they're pretty active, they would feel more comfortable recovering at home. And for that particular patient population, outpatient hip replacement is appealing.
When Dr. Kaminski and I were talking about the procedure, he started asking me questions about, I said, I want the athletic treatment and I really needed to work. I needed to get this done and I needed to get through this. And then that's when he said to me, well, you are a candidate for outpatient surgery. I said, really? So I was really excited about that.
Your body mass index, your weight to height ratio needs to be ideal, which typically is under 40. Patient needs to be fairly active, so this might not be a great idea for somebody who's 90, but somebody who's physiologically young, say in their 50s, and they really want to get back to work. Somebody's got a good social support network. Somebody who is trying to recover as quickly and safely as possible and does not desire to be in the hospital setting. Those particular types of patients are the ones that would benefit well from this.
I am exactly 3 weeks out from surgery. I immediately noticed the differences, like right after surgery. The pain levels that I was having at a 8 to 10 were, even after surgery, were like a 1 to 3. And it was a totally different kind of pain. It wasn't the same pain. And I've noticed that I actually am probably moving and doing things at about 75% more than what I was doing prior to surgery with the pain and the limitations I was having.
Most people, when they have hip replacements, the pain is so debilitating that even without anesthesia, it's remarkably improved. And now add all of these things, such as not cutting muscle when you do the surgery, such as adding all these different anesthetics, it's phenomenal. It's misleadingly easy in that you almost think you can do more than you can, and so our job is to slow you down in that regard. But do you need to necessarily sit in the hospital and have somebody come in and look at you every 5 seconds? You can do that, and that traditionally has been what we've done, but you don't have to do that.
For about 5.5 months, my whole life had to adapt. I work with special needs, so I was unable to play with them like on the floor or get down and tie their shoes when they became untied. I'd have to get someone else to do it, or I'd have to get a chair, sit down, tie their shoes. I would have to stretch my leg out sideways to be able to bend down to pick things up off the floor. I couldn't dance, I couldn't walk anymore. I came home from work and would just basically lay in bed and go to sleep. I am looking forward to being able to play with the kids that I work with. What I mean by that is being able to run and tease and play and kick balls and be able to dance. So I cannot wait to be able to move again, to be able to have life again, because it kind of ceased for a long time and I'm ready.
In the large metropolitan areas, there have been pressure to do this because there's a larger patient population that fits this category. East Texas is now developing this program because it's growing here as well. And so we have now become the first to our knowledge in all of East Texas to do planned outpatient hip replacement surgery. And we've done enough patients now where we're seeing the great results.
I think that this is what I wanted, but I held back thinking, okay, just in case it doesn't go that way, but it has gone exactly how I wanted it to go. I don't know if it was expected as much as it's what I wanted, and it happened exactly how I wanted it to.